All right, so we are continuing with thorax now. All right, so today I want to talk about the pericardium, then tomorrow, Monday probably, we'll then finish with the heart then. Okay, so here we go, some boosters. So I want to talk about the pericardium. The pericardium, all right. Okay, I admit that one. All right. So the pericardium, generally, we talked about the mediastina that, are these divisions of the thorax, the mediastina. Remember, we talked about the superior mediastina and then the inferior mediastina. The inferior mediastinum, which is then divided into an anterior mediastinum, that has got the lower part of the thymus, the mid mediastinum, that has got the heart, and generally the pericardium, and then the posterior mediastinum with the great vessels in the esophagus as well as the thoracic duct. Okay. Now, then when we talk about the pericardium now, the pericardium is generally a sac, okay? So it's generally like a bag and that encloses the heart, number one. So it encloses the heart and then as well encloses the roots. So remember, it encloses the roots of the great vessels, okay? So the great vessels entering and leaving the heart are also covered by this bag, okay? Right, so it's located within the mediastinum there, okay? And this bag contains the heart, right? Right, but covering the heart is fluid, right? That is called the serous fluid or the pericardial fluid, which is around 50 ml. So remember the pleural fluid, when we did the pleural cavities, they also have got the pericardial fluid there, all right? Then this fluid is important for lubrication of the heart, okay? So during pumping, when the heart is moving, there is this fluid, right, to reduce what? Friction, okay? Now, then the pericardium, this sac is made up of two coverings. So there's an outer fibrous layer, right? There's an outer fibrous layer, okay? So this fibrous layer is the one that is adhering to, or actually is to the central tendon of the diaphragm. So the central tendon of the diaphragm, okay? Then there's an outer fibrous layer and then an inner serous layer. So remember, outer fibrous and then inner serous layer. The serous layer is then divided into an outer parietal layer and then a visceral layer. I mean, this is simple. You remember from when we did the pleural cavities, right? So with the parietal outer layer and then a visceral layer. The visceral layer is adherent to the heart, and then the parietal layer is adherent to the fibrous layer. So from outside going in, we go fibrous layer, parietal layer, and then visceral layer, right? Then the fluid between this fluid, this serous fluid is between the visceral layer and the parietal layer. Okay, so that fluid that we were talking about then is located between the parietal layer and the visceral layer, right? So if they ask you about this fluid and then they say it's located between the fibrous layer, the fibrous pericardium, and the parietal layer, that's false. Okay, so it's between the parietal layer and the visceral, just like within the lung. Okay, so that is the pericardium. Let's do a little bit of drawing there. So I'm saying that if we have the heart there, right, we generally have the heart and then the great vessels entering the heart. So the great vessels entering the heart there, right? So just my little sketch there. So that's the heart there, right? So I'm saying that covering the heart, we have these layers from inner part, so the inner part to the outer part. So we actually have these layers there. So we have a visceral layer, right, that is adherent to the layers of the heart. So we have a visceral layer, right? And then outside the visceral layer there, we have a parietal layer. So we have a parietal layer, right? But between the visceral layer and the parietal layer, there's a gap. So there's actually a gap there, right? But this one is actually adhering to the heart tissue there. Right? Then outside that, then we have a fibrous layer that is adherent to the parietal layer. So the fibrous layer is adherent to the fibrous layer, right? So this black is the fibrous pericardium. Then these two are the serous pericardium divided into a visceral, because it's adherent to the viscera. This is the visceral organ, right? And then a parietal layer, all right? This is very important. Why? Because we will know the location. We will actually know the location of fluid. So the pericardial fluid is located in this space. So that's where we have the pericardial fluid, the serous fluid there. It's important. Why? When the heart is pumping and moving, right? Since it's moving with this layer, right? The adherent there, right? There won't be friction between the visceral layer and the parietal layer. We don't want that friction because it brings our problems that we'll talk about later on, right? When we have less of this fluid and then there's fibrous tissue being formed there, right? There's rubbing there, right? During pumping, we don't want that. So that is the function of the serous fluid there. Okay, then this is very important. Why? Because by development, okay, so by development, these two layers develop from the parietal layer, right? From the parietal layer of lateral plate mesoderm. So it's simple. They develop from the parietal layer of lateral plate mesoderm. Then this one and the heart develop from the visceral layer. So that's simple. So these two, they get the same nerve supply. So because the heart works with autonomic nervous system, these two get from the autonomic nervous system. These two develop from the parietal layer. That is the same place where we have the body wall forming. So these two are innervated by the somatic nervous system. So they're innervated by the somatic nervous system. That's why they're innervated by the phrenic nerve. So they're innervated by the phrenic nerve. And then these two are innervated by the vagus nerve, that is parasympathetic, plus the sympathetic nerves that are coming from the spinal cord there, okay, that are coming from the spinal cord, right? Right, now, so now that is generally about the coverings. So this covering goes on to cover even these great vessels. So this covering goes to cover even these great, the roots, only the roots there. So it covers there completely. That's the fibrous layer, right? So all the other layers also do the same, right? And then remember I said that the fibrous layer is then adherent or tethered to the central tendon of the diaphragm. So when you're in a dissection lab, then you're in spot test, right? You can actually see, no, this layer is the fibrous layer. Why? Because actually it would be like a one layer with the central tendon there. Okay. So with the tendinous sheath there, right? It will seem like it's just one continuous layer there. Okay. Right. Now, let's now talk about so remember, I want you to remember this. So these layers, right, specifically, let me highlight that. So specifically, this is what actually happens. So these layers, this parietal layer and the visceral layer are then continuous with each other towards the roots. So remember, when we did the lungs, the parietal layer and the visceral layer were continuous with one another, right? Around the aisle of the lung. So the same happens around the roots there. So that's it, right? So around the roots, these two layers are then continuous here. So you see that the visceral layer is continuous with the parietal layer, right? So these structures appear as reflections, right? They actually appear as reflections along the great arteries and the great veins that are entering and leaving the heart. That's where we came with that mnemonic. Remember the VOTA. I talked about this in embryology as well, right? But now you have to know it in gross anatomy, the VOTA, right? When we say that the reflections are these, between the great veins, right? So between the great veins, these reflections, where the parietal layer is continuous with the visceral layer, are called oblique sinus. So it's called an oblique sinus, right? And then between the great arteries, so the arc of the aorta and the pulmonary trunk, the reflections there are called transverse sinus, right? So oblique sinus between the great veins, transverse sinus between the great arteries. If they ask you otherwise in the test, you know what to say there, okay? So that's about the coverings there. So remember, I said by embryology, these two layers develop from one layer by embryology. These two layers develop from the one layer. So this is coming from the heart, and this layer are coming from the visceral layer of lateral plate mesoderm. These ones are coming from the lateral, the parietal layer of lateral plate mesoderm. Okay. And let's talk about the borders now of the pericardium. So this is very, very simple. I mean, this is the simplest thing you ever do in school. So let's talk about these things. So for you not to claim that, I want to teach you how you can remember that very well. So so the lower extent of the pericardium obviously is the central tendon. So remember, that's our diaphragm, J shape. So that's where we have the central tendon at the upper part, right? So we have the central tendon. And remember that I say that the inferior vena cava, right, is an opening at the central tendon at the level of T8, okay? At the level of T8 vertebra, right? And then remember T8. Remember when we talked about the angle of Louis, right? Remember we said that the angle of Louis divides the superior mediastinum from the inferior mediastinum. In the inferior mediastinum, the pericardium is one part of the inferior mediastinum. And then we said that the division there is formed posteriorly by the intervertebral disc between T4 and T5. And then, may we meet, please mute the mic there. So we say that the borders for the borders for the pericardium, please mute your mic. The borders for the pericardium, right, are these. The posterior border for the pericardium will obviously be starting from T5, right? So we say there is the superior mediastinum, the inferior mediastinum. So the borders are from T5 going down to T8. That's the posterior border. So if they ask you otherwise in the exam, you now know what to say. So you don't even have to claim. You will obviously know that the lower border of the pericardium is the central tendon, which is at the level of T8. That's where the opening of the inferior vena cava. The upper border, right, is that line separating the superior mediastinum and then the inferior mediastinum. Okay, those are the borders. So that's a posterior border there. Okay. Then the anterior border is obviously the body of the sternum. So obviously the body of the sternum there. All right, that is the body of the sternum. So we expect that if there's a stab wound, right? So someone is given a stab there by a knife, we obviously expect that the heart is injured. Okay, right. And then in terms of ribs now, so in terms of the ribs, counting the ribs there, we obviously say that we are at rib number 2, right, up to rib number 6. Okay, so rib number 2 to rib number 6. Remember, the ribs move transversely. Okay, so the ribs actually move transversely. Don't confuse with this one. It's easy. Why? Because we actually say that, you know, rib number 2 goes to join with the manubriosternal joint. So at the angle of fluid. So it makes sense. That would be rib number 2. And then rib number 6 comes with this very point where we have the ziphisternal joint there. As well as rib number 7. Right? So that is the position where we find the heart there. Right? So that is the pericardium. Right? So we said it's behind the sternum and the 6th to the 2nd to the 6th costal cartilages, right? So 2nd up to 6th costal cartilages. Then it's also anterior to the 5th, right? Up to 8th thoracic vertebra. So you don't have to claim that, right? So let's talk about the autonomic supply. So for the autonomic supply, we say that the nerve supply is either from the phrenic nerve or for the autonomic nerves. Now you would know why, right? So remember, the thoracic autonomic nerves are the vagus, right? That is parasympathetic, and then the sympathetic nerves that are also giving the sympathetic, easy like that, right? Then I want you to note that the heart and the visceral pericardium are innervated by the autonomic, because we say that embryologically come from the same place. Then the parietal and the fibrous layer are supplied by the phrenic nerve, right? They're supplied by the phrenic nerve, right? And then blood supply is from the pericardial phrenic vessels. So the pericardiophrenic artery is a branch of the internal thoracic artery. So remember, internal thoracic artery that gives the anterior intercostal arteries there, right? So as it moves, so if we have the sternum, so if we have the sternum there, remember I said that this artery is very important, usually for spot test there. It will be moving parallel to the sternum and then ends by dividing into musculophrenic artery and the superior epigastric that goes to the abdomen, and then the musculophrenic artery there, right? Whilst in these points, it will be giving the anterior intercostal arteries, right? But before that, at the top there, it gives one branch that goes into the pericardium, right? To supply what? The pericardium, obviously. And then it goes down, down, down until it reaches the diaphragm and then supplies the diaphragm. That's why it's called a pericardio for the pericardium, phrenic for the diaphragm, right? So I'll show you these vessels, right? But let me come back to the nerve supply. Something I have to explain there clinically very important about the referred pain of the heart. So let's say the heart is damaged. Remember, I said that the visceral organs, right? You can't feel pain, but rather they would, refer the pain to other positions of the body. For these sympathetic nerves, these are the ones that carry the pain sensations, right? So they carry the pain sensations. But specifically, they'll be carrying the pain sensations, right? From the heart, and then they would put them in the spinal cord at the level of T1 around T4 there, right? T1 up to T4. But there's something interesting that T1, right? T1, T2, and then T3 there, and then T4. These are the sympathetic nerves, right? That supply the heart and also take the pain sensations, right? So this is what will be happening actually. T1 and T2, they give branches, they also supply the upper limb, remember? So they also supply the upper limb, right? But specifically, I want to talk about T2, right? Specifically, I want to talk about the T2. What happens is that when pain comes from the heart, right? So let's say these are the branches that are coming from the heart there, right? So they're coming from the heart with pain sensation. And quite I can't say pain sensation. Let me just say pain impulses, right? Pain impulses. And these impulses will go to the brain, right? And remember, I said that the brain will actually be confused, right? It will actually be confused. Why? Because you have some somatic sensation coming as well from the upper limb with these nerves there. Specifically T2, right? T2, it gives a branch that goes to supply the medial aspects of the arm, the medial aspects of the arm, right? So this branch is coming from the costals, right, to go into the brachii. So it's called the costal brachial nerve, right? So a costal brachial nerve, right, or intercostal brachial nerve, or just a costal brachial nerve.